I'm Morgan Burgach. I'm one of the plastic surgeons here at UK. For me, it was more of everything in plastic surgery allowed me to be more creative than anything else. So I do a lot of crazy things in basically hand surgery, microsurgery, plastic surgery. But aesthetics is really that ability to be more creative for my patients. I have all types of patients, so 3 clinics. So I have my hand clinic, plastics and reconstructive, where we do micro, and then aesthetics. So it's all walks of life, young, old, male, female. For aesthetics, a lot of it is patients just kind of starting out, maybe starting with Botox, filler, skincare, and then as they can kind of continue that journey, it could be more operative, abdominoplasty, mommy makeover, breast lifts or augmentations. I think one of the biggest strengths of UK, and especially our aesthetic center, is really having board certified plastic surgeons. And so I think that's one of the bigger distinctions between us and maybe someone who's not, or someone in the community is, not everyone is board certified, not everyone has operative privileges at a big hospital, and that's just a higher standard of care. So I'm glad that we could offer that here. So we do have a multidisciplinary clinic, so we have multiple providers, both plastics and facial plastics, and all of our staff is obviously trained in aesthetic surgery, as well as having a new esthetician, so we can offer basically all of the new advanced technology, some of the more common procedures, neurotoxins, fillers, as well as lasers, skin peels, kind of the full spectrum of plastic surgery. Honestly, I love my job. I have the best job. So, but really, it's that it's taking care of patients, and I get that throughout my entire kind of career here at UK. But as I was talking about, aesthetics is one of those more elusive fields. Really allows you to be more creative, and it's not suited for every surgeon or even every plastic surgeon. Really, you have to be able to think kind of 3-dimensionally and on the fly, and really tailor and customize that treatment plan for each patient. I think sometimes patients make some missteps. I would urge every patient, if we had that chance, to go out and explore, meet a lot of different plastic surgeons, make sure they're board certified, obviously, and really find that provider that's a good fit for them. And we see, unfortunately, a lot of patients that have gone elsewhere, sometimes medical tourism out of the country, even down to another state, and they just don't have a good outcome, or they have an infection, and then we end up taking care of them, which is great. But if they would have just seen us from the start, we could have really helped them out.